Okay, let's start with our next presentation. Ziad Al-Hammad will present the next presentation. He's from King Saud King Saud bin Abdulaziz University for Health Sciences, and he'll be talking about dental aesthetics and attitudes among King Saud bin Abdulaziz University for Health Sciences, first pre-professional year students.
Assalamu alaikum wa rahmatullahi wa barakatuh. I would like to welcome you all for our presentation for today. My name is Ziad Abdulaziz Al-Hammad. I'm from King Saud University for Health Sciences in Riyadh, what you call Haras University. I would like to start with my presentation, and my topic for today is dental aesthetic and attitudes among King Saud bin Abdulaziz University for Health Sciences first pre-professional year students. And this study has been conducted obviously in King Saud bin Abdulaziz University for University for Health Sciences, and I got help with my friends on my group members, Muhammad Al-Maliki, Abdulaziz Rumeh, Ahmed Al-Faqih, and we were moderated by Dr. Abir Al-Subayt and me, the presenter Ziad Abdulaziz Al-Hammad. Firstly, we would like to go with the content of our presentation. I'll go with the overview, then I'm going to give you a quick introduction about it. And thirdly, I'm going to talk about the literature review, methodology, result discussion, and conclusion recommendation. Just give you a quick hint about it to remind you of the topic. It's dental aesthetic and attitudes among King Saud bin University for Health Sciences. The study design we use is the cross-sectional study design. Our primary objective in here is to investigate the attitudes, whether they have positive or negative attitudes toward dental aesthetic. And also we would like to know what the problems that they have, and also we would like to know what are the needs for treatment, what type of treatment they want. In addition to that, we want to know the effect of parents, occupation, region, gender, and school in each one of these objectives, which means that I'm going to investigate 3 factors and to know the effect of parents, occupation, region, gender, school in each one of them. To start with the introduction, just to give you a quick hint, we mostly, all people express their beauty differently. Some people may express their beauty by the way they look. Some people may express their beauty by the way they behave, actually. And increasingly, the way they look, you need to think about the facial appearance. And when you think about the facial appearance, it has many components. Just to start with, you need to know that people have been expressing their physical beauty by the way they look. Face is one of the most important ways to show physical beauty. Many surgeries, cosmetic treatments, and makeup to express the physical beauty of the face. And when you go to specific for the face, you can see many factors. You can see the eyes, the nose, the mouth, and specifically I'm thinking about the mouth, which is our specialty. It consists of many factors, such as the shape of the lips, the smile, the teeth, the gingiva, the color of the teeth, the arrangement of the teeth, and lots of factors. And for that reason, mouth is an important organ to express aesthetic in very different and unique ways. Size and shape of the lips, mouth, corners, and smile all play an important role in aesthetic. Smile is a pleased, kind, or amused facial expression, typically with the corners and the mouth turned up and front teeth are exposed. And we go to the literature review. I'll give you just quick quotes which were expressed regarding the same topic, which says, dental appearance is an important feature in determining the attractiveness of the face and thus plays a key role in human social interaction. Among significant factors affecting overall dental appearance are tooth color, shape, and position quality of restoration and general arrangement of dentition, especially in anterior teeth. And another quote which says, aesthetic has become an important issue in modern society as it seems to define one's character. My references are below the quotes, so it's easier to track them. As you can see from these quotes, how important the dental aesthetic, which can even influence the psychological status of the individual. Other quotes to go with, attitudes and awareness can differ from one to another. Both researchers and subjective clinical experiments suggest that patient and dentist differ for their evaluation in dental aesthetic. And also I have my reference here. And this is still us that we need to investigate more. What could be the reason people have different ideas about the smile? I can give you a smile and someone say that, okay, this smile is perfect. Another guy say, no, I like that smile better. So why do we have different perspective of this smile? And this is why basically we did our research. To go with the methodology, before I go with the methodology, I would like to tell you that I did my pilot study and to check the reliability of my questions and my questionnaire, and thank God all the questions were clear. I targeted the same target and all the questions were clear after distributing 20 questionnaires just to check the question. We did it for males and females. For females, simply the methodology, we are 4 members, so every member has 50 questionnaires. Each member went to a large auditorium, which consists of 4 small groups to increase randomization. Every member distributed his 50 questionnaires randomly and received them at the same time. Total of 200 questionnaires have been distributed. For female, we did exactly the same thing, but due to social and cultural limitations, we got help by female faculty. And this is what I'm basically expressing here. These are the numbers, are just rough numbers about the population sample size. Our population for male, 583, for female, 412, and we have the total. Our sample size 144 and 134 for female. Number of questionnaires 200 for each, and we have more questionnaires distributed more than the sample size, just to make sure that we cover our sample size. And we had responded and non-responded, and to define the non-responded are the questionnaire which were not received or that have questions or three or more questions which were not answered. And these are the response rate, 77 and 69.5%. Sorry. And from that, just to express and just make it to illustrate how we did it, so each member had 50 questionnaires, and we randomly distributed to a large auditorium which consists of 4 groups. We distributed an Arabic questionnaire which is easier to read and understand for the students, and this is the copy of the Arabic questionnaire we used. And also we had an English questionnaire which was easier for us to insert it in the SPSS instead of the Arabic questionnaire. And the result we got from that, as I discussed before, we had 3 objectives: knowledge, attitudes, problems, and needs. Going firstly to the knowledge and attitudes, we had subject knowing about aesthetic dentistry 80%, and subject who didn't know about aesthetic dentistry 20%, which is good that we have quite good knowledge about aesthetic dentistry. And we want to know the source of knowing about aesthetic dentistry, and what we can notice here, and family and friends are the most common source for knowing about aesthetic dentistry, and followed by internet, and the least common source is the school curriculum, which I mean here the high school curriculum. And when we investigate the attitude, we had positive and negative attitudes, and I need to define how we measured whether it's positive or negative. We considered it as positive if dental aesthetic is one of their concern and they're satisfied with the general appearance and color of their teeth, and which was 21% of the sample. Negative attitudes for the ones who are not satisfied, dental aesthetic are not of their concern, they're not satisfied with the general appearance and their color of the teeth, they're not satisfied about it, which was 79%. And when we want to investigate the effect of other factors such as parents' occupation, region, gender, type of school, knowledge, we found that there is no association except for mother occupation, which had a borderline significance. And the meaning of borderline significance is that if we increase the sample size, it might lead to a significant relation. And here's my multivariate analysis for it, and having non-working mother increases the likelihood to have a negative attitude by 74%. And going to the problems, and as you can see in this bar chart, the most common problem that they're having is having teeth are protruded, and followed by having fracture in the anterior teeth. And obviously, because of the revolution of composite resin, we have now low percentage of have non-aesthetic restoration in the anterior teeth. And when we investigated the effect of these regions, gender, type of school, and problems, we found that there is a significant relation between the gender and the problems, which says that males have double the risk of having dental problems than female, and these are my statistical tests. And when we investigated the needs for treatment, obviously they are concerned about the appearance more than what they really have. So we had teeth whitening as one of the most common dental need that they want, followed by orthodontic treatment, and the least common need was the prosthetic treatment. Effect of parents' occupation, region, gender, and school, we couldn't find any significant relation except for mother's occupation, which had a borderline significance. And having non-working mother increases the likelihood to have more need by 72%. And now, so having non-working mother increases the likelihood to have negative attitude and also to have more needs by 72%. And it could be due to the education of the mother and its knowledge. And just to go through the discussion part, as any study before, it has some other studies which are similar to it and other studies which are somehow slightly different. So we compared it with other studies. So our study here, it says 51 were satisfied with the general appearance of their teeth, 27 were satisfied with the teeth color. In another study that was conducted in LJOF, 50% were satisfied with their good general appearance of teeth, and 34 were satisfied with their teeth color. And it's somehow similar results we had to this study which was conducted in LJOF, and which could be a good indicator. However, when we tried to compare it with other studies in the UK, it has 76%, which is quite different from our study. And this could be attributed to the differences in measurements, sample size, and also our culture, which can be the reason why we have somehow different numbers. So this could be attributed to the difference in sample size, use, measurement, evaluate satisfaction, psychological factors, the religious and socio-cultural factors. Different samples, different measuring technique, individual characteristics and psychology, as well as cultural, religious, and racial background might explain the controversy regarding the relationship between gender satisfaction, dental appearance, and tooth color. And here is my reference. And now, just to conclude and give you a quite recommendation, to conclude that to sum up our majority of King Saud University for Health Science, first pre-professional year students showed a high level of knowing about dental aesthetic, but however, on the other hand, they had shown a low level of dental attitudes regarding dental aesthetic. For next research, I personally recommend to increase the sample size, which might lead to more significant relation, and also to use more variable, which might lead to more and more results. I would like to thank you very much for your kind attention, and if you really have any question, I'm really willing to answer. Thank you very much.
Thank you so much. Okay, 5 minutes for the questions, please.
Yes, very good, Ziad. Attitude study is difficult study to start with. So most of the question, you don't have to answer it. It's the design of attitude question is difficult. So if you start with aesthetic, one of the comments, I did not see a definition of aesthetic, clear definitions, so you can measure through all the patient, how did they reflect back, because everyone will have their own definitions according to their own rather knowledge or whatever you say. So this is a comment. The second comment you made, when you said you did a questionnaires of 50, and you, excellent, you said that you did pilot, because I was skeptical when you first said it. So when you did the pilot, also, among 50 questions, it is perfect score. No one of the question, as you said, was invalid. That's a little bit difficult to get or accept. And the reason I will tell you why, because here when you deal with expert, most of the time, we'll get at between 15% of infallibility. And then the other question is, what type of methodology did you use actually to study the fallibility? It's kind of complicated. Then the simple technique you used of translating from Arabic to English and just asking the patient in Arabic, and then you fill it in English. This is what you did.
No, actually, we followed in Arabic, but we used it just to make to work on the SPSS.
So
To design the table itself.
yes, here when you do this one, you actually lose some of your fidelity.
No.
So you need to do something called test retest.
Retesting.
Just changing the questions from Arabic to English or English to Arabic here, the Chrombeck alpha will change immediately, which is the measure we use to measure the internal consistency of the questionnaires. So here there is a little bit of, I mean, it could be different. Most probably will have different.
However, we tried to translate it in the exact meaning, not literally, just the exact meaning.
Even though it has to be retested. And then one comment also, I did not see adjusting factors. You did not mention what type of confounders or cofactors that needed to be adjusted. And simple example, you said on your presentation that the mothers who are not working, yeah, this is what you said?
Yes.
The children will have less attitude or negative attitude towards statistics.
Yes, negative attitude, yes.
Yeah. Here, most probably it could be due to the socio-economic, not to the education or the work or the job.
But
And I'm not saying it could be, it's 100%, but most of the time we will have to adjust for it. And the income of the house, it's a very critical part in this special point. So I like the study, and I hope the design can be a little bit modified and maybe adjusting factors according to the populations, because sometimes when you taking and try to compare it to an international study, let's say you use the British, which has clear hierarchy, different than Saudi population, sometimes it will be a little bit of, you need some modification to fit it to our population. Very good job, and hope to see you again.
Okay. Thank you so much.